started, thank you for being on time. We really appreciate it. We want to be respectful of your time. My name is Amy Luckowitz. I know most of everybody in here, I think, for the most part, but I oversee our federal drug prevention grant, so DFC, and my title stands for Drug-Free Communities. We are entering year 10 of 10 of federal funding, if you can believe it. That flew by. It'll start tomorrow is our year 10. I myself have been working for the town for just over 12 and a half years, mostly with youth development, but very much focusing on youth substance abuse prevention. Before we get started, I have to apologize. I have an optical migraine in my left eye, so I might have to read my notes versus looking at the screen. I'm having a hard time looking at digital stuff. Hi. Thank you. This is Laura Miranda. We'll introduce her a little bit too. She's to go first. Got it. And I'm very happy to introduce Marcy Bailey, who is, I'm sure all of you have heard from her, and she has been our main cheerleader in Nicotine-Free Generation. Moving from this point forward, if everybody's okay with it, we'll refer to it as NFG. You all know what it was about. Used to be called Tobacco-Free Generation, but we are more interested in nicotine in general. So we'll talk more about that, and I'll turn it over to Marcy.
Okay, thanks, Amy. Thank you to everyone for coming tonight. We have several citizens, several experts on nicotine and nicotine-free generation regulations, and we have two of the three members of our Board of Health who are here importantly because the Board of Health is one of the regulatory bodies in North Reading, the other being Open Town Meeting, that can decide whether the town adopts nicotine-free generation. So we have Gary Hunt, our chair, and Karen Martin, a member. Do you want to say anything, Gary or Karen, before we get started? They're here to listen.
Well, welcome all of you that have interest in this topic as we do. We're here to listen, like everyone else, and take everything under advisement. Thank you for coming.
Thank you both for making the time to come tonight and for all the work you did with us leading up to this session. We will have two more sessions later in the fall, which we'll talk about later tonight. So I'd like to start by asking you all a question. At what age do you think it's a good idea for young people to start using nicotine? That's the question we asked ourselves when we started as the Youth Substance Use Prevention Coalition. When we started considering and looking at nicotine-free generation regulations, we looked at what nicotine can do to young people's brains. Brains develop at least through the mid-20s. It can cause learning deficits, attention deficits, and very importantly, nicotine is highly addictive, very difficult to quit, and can lead as a gateway to other substance abuse. So when the coalition voted unanimously to pursue what we're pursuing here tonight, sharing with the community information about NFG, we asked ourselves that question: at what age do we think it's a good idea for young people to start using nicotine? And unanimously, our answer was never. And that's why we're here tonight, to show how nicotine-free generation can move us reasonably and gradually toward a world where no one becomes addicted to nicotine. So with that, we're going to share with you some information about NFG, and Amy is our resident expert in prevention, is going to share with you some information about nicotine specifically. Can everyone hear me? Okay. Am I too loud? Okay. So nicotine-free generation, which was previously known as tobacco-free generation, is implemented at the local level in Massachusetts to limit the sale of nicotine products as of a certain age. It used to be known more as tobacco-free generation, but as you'll see, and we'll show you some products later, there are many ways to deliver nicotine, and combustible tobacco is becoming less common, and other products are becoming more common. So we try now to refer to it as NFG. What NFG does is, instead of a young person being able to buy nicotine when they turn 21, it sets a date certain where it's adopted, after which no one can come into a retail establishment that sells nicotine in that town at that age and buy, before that age, and buy nicotine. So for example, it's a little tricky, but if a policy were to go into effect on this January 1st, anyone born after January 1st, 2005, so 21 years old, could never buy nicotine. So this year, 21-year-olds couldn't purchase nicotine in North Reading should we adopt it. Next year, 21 and 22-year-olds, and so on. It incrementally phases out nicotine sales, as I've just explained. So it is considered retailers. it's not swiping a big swath of their business away in one fell swoop. There's many, many years to adopt to it. And importantly, let's see, I'm just making sure I keep up. It will not take away internet sales or sales in other towns that do not enact it, but it does limit access at the local level. It limits young people walking into a convenience store in North Reading and purchasing nicotine products with cash. You know, if you buy on the internet, you need a credit card, and that's important for access. And finally, the reason we're doing this is that our coalition's name, it's the Youth Substance Use Prevention Coalition. It's to prevent addiction to nicotine before it ever gets started. So that's a roundup of what NFG is. Amy's going to take over now and talk about prevention. Mm-hmm.
Thank you. So it is really important that we really zero in on primary prevention, and that's for several reasons. But the first is we're trying to prevent a disease from ever starting. And that disease is not necessarily lung cancer or any things that come with combustible cigarettes, but we're trying to prevent the disease of addiction. And primary prevention is literally my entire charge. The federal government sponsors my position to primarily prevent youth substance use. So my number one population is kids that never used, and to keep them from never using. So a couple of examples of primary prevention: seatbelts and helmets, which we all know to help keep safe. But there's also secondary prevention, which this is an action that focuses on early detection, some things like screenings, even the EI programs that many young people go through. And tertiary prevention focuses on interventions that slow or stop harm from a disease. Things like medicine, tumor removal surgery, masks, substance use treatment. And you can kind of see the differences here. But again, we are totally focused on primary prevention in this model. So I want to walk you through this little harm minimization model. And on the far right is extreme toxicity. No surprise there that cigarettes rank pretty high on that. And when we talk about extreme toxicity, we're also including disease like lung cancer in that category. But it's important to note that as newer products emerge, like vaping and other products that we're going to talk about in a minute, we simply don't know what, if any, other diseases might be found related to those new nicotine delivery devices. Also, no surprise, on the left-hand column, we have the least risky action being don't ever use. So it's a very obvious thing that we want to really invest our time and our efforts into preventing use from ever starting.
So just briefly, we're going to take you through some of the history of NFG, specifically in Massachusetts. It was originally proposed in Singapore, as noted here, and a little bit of trivia, the only nation worldwide that's adopted it fully is the Maldives. So not only can you see beautiful water, you can be free of nicotine if you go there. But Brookline was the first municipality to pass it in 2020. The actions, which you might have read about in the media, were challenged in state judicial court, and the action was upheld unanimously. Many other communities, and we'll talk about those in a minute, have pursued NFG and adopted it, and most, like North Reading, have prevention coalitions focused on prevention of addictive substances for young people. There are other examples that are not exactly the same, but similar, where public health is protected by regulation, and that's not being able to use lead-based paint or gasoline or asbestos anymore. Those are seatbelts. You could probably yourself think of a few other examples. And so with that, as I started with the coalition thinking the right age for young people in North Reading to start using nicotine is never, we decided that it was time, like other towns, to pursue NFG. North Reading has been a leader with the Board of Health adopting regulations to not add density of retail tobacco sales. That was adopted last year, and also for flavored tobacco and not having sales of that, which is targeted to young people. So 17 cities and towns in Massachusetts, covering a population of 500,000, have adopted NFG. For North Reading, a town, there are two ways that NFG can be adopted, and that's either by Board of Health regulation or by a general bylaw at town meeting. Interestingly, 16 of the 17 towns have adopted it through Board of Health regulation. One, Brookline, adopted through town meeting, and they differ a little from North Reading in that Brookline has representative, not open town meeting. So that just covers what we just went over, that 16 of the 17 towns have gone through the Board of Health to adopt NFG. This aligns with the Community Impact Team's mission, which is really to maintain and improve the quality of life and health and safety for the residents of North Reading. And the Community Impact Team has been wildly successful here, dare I say, for well over, I believe, 12 years. The Youth Substance Use Prevention Coalition is funded by a grant. We're in year 10, and we are an arm of the Community Impact Team and work very closely with them, but with the specific aim of preventing youth from using harmful substances. And we've partnered in many discussions, and we're really glad that the Board of Health members are here tonight to hear this, on issues of public health. And as you can see here, this is from the Board of Health's mission on the town website. One of the areas in the Board of Health's purview is tobacco control programs. So that's sort of takes you through how NFG could be adopted in North Reading and why this group is here tonight. So Amy's going to talk a little bit about why NFG and about some data from North Reading, and then we'll come back to some questions that you may have, some frequently asked questions we've gotten, and then we'll take questions from the audience. So Amy?
Thank you. So we're going to start at the macro level and generally why are we pursuing this, and we'll kind of zoom down into North Reading because I think it's very important to understand how NFG will affect our residents and neighbors here. Almost 500,000 of Americans die from preventable smoking-related diseases each year. It is still the leading cause of preventable death. More than 80% of smokers start at age 18 and virtually all by 26. In just a second, we're going to learn that North Reading unfortunately has a younger age in which they first start. The tobacco industry's playbook is a very real thing, and this has been proven over and time in court cases. And unfortunately, this playbook, the sole goal is to create lifelong users, and that is the exact opposite of what we're trying to do. Very importantly, why NFG is we like it because it's a slow burn, pardon the pun. The Board of Health asked me to go speak to all of our retailers. So we have 10 retailers in town, and I'm happy to tell you that I spoke one-on-one with all of them. And I want to share with you the 3 main things that I learned from the retailers. It is important to think about the economic impact that this might have for those people, so great conversations happened. Number 1, I learned that some tobacco companies had already sent people into the retailers. And unfortunately, they provided them with some wrong information. The number 1 thing that they said to them was that you're going to lose your entire business when it comes to tobacco. The town is going to ask you to take all of your products off the shelf. This is not prohibition. We are not asking them to do that at all. So I had a really great conversation with a couple of them clearing that up. You kind of saw their anxiety alleviate a little bit when we had that conversation, but it's unfortunate that they were told that because it really did stir the pot. The second thing was for the retailers that live in North Reading and were parents. They had 2 reactions. As parents, they were all in favor. As retailers, they noted that they were not bothered as by the time it has any real impact, they're going to be no longer in North Reading. One retailer specifically noted that they didn't care because, quote, I'll be retired by then. Main impact coming in 21 years, they all anticipate to be gone, retired, living the life. And the last thing I learned was that, in fact, nicotine sales represent a very small percentage of most retailers' revenue. In fact, most retailers were unable to tell me how much revenue they took in from it because it was so small. And as you know, North Reading does not have any exclusively designated smoke shops. So I wanted to really address that and make sure that everybody knew how that was going to affect North Reading. I think it's important that we talk about some of the new products that are out, and I brought some samples. So, first things first. All the products are sealed up, so they should be safe to touch. If you don't want to touch it, no problem. We'll move them around for you. If you don't mind, Marcy. Thank you.
Can I separate them out?
Absolutely. Whatever you want to do. She's going to divide them up. I'm going to show you a couple of pictures, though. The first thing is high-potency salt nicotine pouches. Salt nicotine discrete pouches like Zyn represent a change in form of nicotine consumption. Nicotine is absorbed through the mouth and does not cause saliva discharge like traditional chew. Because these pouches use high-potency salt nicotine, These carry are particularly attractive to athletes, not just because they don't create the colored spit, but because the potency is so high, it causes a rush when you first put it in. In fact, it's very common with weightlifters for the same reason. In North Reading, Zyn pouches, that by the way obviously look a lot like mint tins, are so popular that they've often sold out in our local retailers, and that's given a real rise to mimic products like Bella. So they do the same thing. There's other products out there, but in North Reading, these are the two main products in salt nicotine pouches. This is an example of nicotine toothpicks. Nicotine toothpicks are sold online, and they do have flavors like mocha, watermelon, mint. They're very attractive, again, very attractive to young people. And Marcy does have one of these coming around. This is a vape Sharpie. The one on the top is an actual Sharpie. The one on the bottom is a vape device. I have it coming around. I'm not sure where it's at right now. Thank you. If you want to look at the bottom, you'll see where the charging port is. The part that would look like the ink comes out, and you put your mouth directly on that. All of them are flavored. All of them. It is illegal to sell products that appear to be like toys. Marcy has some of those going around as well. And in fact, I'll tell you, when we've had the toy vapes out, the ones that look like toys, it's been the #1 thing that attracts young people to our table. So young people will come over to it, and we'll say, look, Mom and Dad, look what they went right for. I have to say, they look pretty cool. I think that they were very smart. And I'm 45, and I was like, oh, what is that? It got my attention as well. But clearly, especially with the case of the highlighter vape, that is not meant to be something that you use out in the open for adults. That is very clearly a concealable device. And I think they were up somewhere in the range of 18 flavors now that one comes in. So again, the top one is real, the bottom one is not real, and that's coming around. Yes.
If that's flavored,
Yes.
is it because it's flavored nicotine versus flavored tobacco?
Correct.
That it's legal?
It's not legal in Massachusetts. I bought that online.
Okay.
We have no jurisdiction online. Yeah, good question, thank you. So let's zoom into North Reading. Every year, I'm in charge of collecting data. It's called the Core Measurement Survey. This is statutorily required by our grant. And we collected about 5 substances. Nicotine, we separate vaping out separately. Prescription drug use, marijuana, and alcohol. What I have up here is just obviously the tobacco and nicotine-related data. The percentage is the percentage of that grade that said that they had used that product in the past 30 days. So for example, looking at the 12th grade, we asked them in the past 30 days, how many of you had used any tobacco, and 18% said yes. Another example, in 10th grade, 1.8% said yes for that question. So I'm happy to tell you, we've had the best numbers we've ever had since the grant started and even before. We are down on average about 15% the past 2 years. That's unheard of. Last year we had a decline. That's not a trend. This year, 2 years of decline. I'm thrilled about that. Hope it goes 3. However, as new products come out, we're constantly fighting that battle. That's why NFG is so important, because it covers all those new products that might tempt young users. Unfortunately, in some areas, North Reading uses more tobacco and nicotine products than the national average. In the 8th grade, you can see the number below the 1.2%, which was our number. The national average for that grade was 10.5. We're doing quite better. But look up to the 12th grade numbers. 18% of our youth said that they had used, but the national average is 1.7 in that grade. Now, one thing that you need to know, it's a little bit apples to oranges, because our data I'm showing you is from 2025, but the national data is a year behind us. So I just want to point that out. But we're hoping it's pretty close. We won't have those numbers just yet. If the number is in green, that means we're doing better than the national average, and the number in red is where we're doing poorer than the national average. And you might be asking, what's going on in that 12th grade? Well, not surprisingly, 18-year-olds know a lot more 21-year-olds, and they have far more access. And in North Reading, we ask the students, if you use, what is your #1 source? And the #1 source is from an older friend or an older family member. #1 source, year after year. So a few more data points I want to share with you. I had mentioned that on average, 18 is the age of first use, but not North Reading, it's 17. I'm happy to tell you that's gone up from 16 as it was the past couple of years, but we want that number to keep going older, keep going older. It is, as Marcy mentioned, a complementary action to the Board of Health's efforts to reduce outlet density from last year. It will include all delivery devices, staying ahead of any future product that might come on the market. I don't know what is going to come after nicotine toothpicks, but I know somebody is working on that. And I don't know what the next thing's going to be. So as long as we're addressing nicotine, it should be covered under Nicotine-Free Generation. And again, I have to bring back, it is primary prevention, stopping the disease of addiction before it ever starts. Okay. FAQs. Before Marcy starts, I just want to mention that the frequently asked questions are real FAQs. They're from our conversations that we've had for the past several months with the community at events like National Night Out, Apple Fest, but also in my one-on-one meetings with the retailers. So these are not just things that we've made up. This is the actual top 8 questions that we got asked.
Okay. So Amy's covered how we got these questions, and some of them might be on your mind, some might be new to you, but these are questions that people have been wondering when we've talked with them about NFG. So the first is, doesn't this take away free choice or infringe on personal rights? Anyone who currently has the ability to purchase nicotine products in North Reading will not lose that ability. So in that way, it's not like prohibition, it's not snatching a right away from adults who have it now, it's phasing it in gradually. As we mentioned earlier, that there is history from lead paints to FDA banned supplements for public health reasons to not sell them anymore. But it's not taking away a personal right. And tobacco has caused the greatest health detriment of any consumer product in history. It kills more people than AIDS, alcohol, car accidents, and illegal drugs, and other risks. So it's not taking away personal rights and freedoms, but it's keeping our next generations healthier. Won't people buy online or over the border? They might. We covered that. People can buy online, but youth would need a credit card to do that. They would need a ride, whether over the border to New Hampshire or to another town. But right now, North Reading is over the border. Reading and Stoneham have both enacted NFG. And I ask you, just like I had asked, at what age should young people be allowed to purchase nicotine and use it in North Reading? I would ask, does North Reading want to be the town where young people from Reading and Stoneham cross over the line on Route 28 to come buy nicotine here? So our neighbors are doing it. We can't control what others do, but we can control how we attempt to keep young people healthy in North Reading. Is this like prohibition? Just very briefly, it's not. It's not snatching away the right for people having it. It's not making the substance illegal overall. It's limiting the sales to people who right now should not be addicted, not buying it, and we don't want them to start becoming addicted when they turn 21. This is my favorite question. Youth cigarette use is down. Why is it necessary? From all the products that we passed around, Big Tobacco is out there trying to maintain their products, their profits from selling nicotine. So whether it's a vape that looks like a highlighter, a toothpick, a pouch that can be between your cheek and gum in a class, and no one would know, they're going to look for the next product that's seems socially acceptable. Combustible cigarettes aren't socially acceptable anymore. They're going to find the next thing that is. So as Amy said, and I think it's really important, that this bans any delivery system of nicotine. Those we know about now, and those that we can only imagine but know they're working on. What will happen to the tax revenue? That goes to the state level. It's a relatively small amount of the state tax income, and it flows through in a very minor way. North Reading is a small town. It's a very tiny, if any, part of our state aid, and it's going to each year. What's going to go away is the percentage of people who turn 21 who are going to buy nicotine. It's small, but over the years, it's going to keep a whole generation free of nicotine addiction and allow the Commonwealth to adjust to its new revenue numbers. How does NFG stop nicotine use for current use? And this is really important. 21-year-olds know 18-year-olds, 17-year-olds. 17 and 18-year-olds have siblings who are 13 and 14. The more years we can put between those who are permitted to purchase nicotine and those younger people that they know, the less likely that that teenagers whose brains are very susceptible to to the high of nicotine and very susceptible to the addiction. The more years we can put between them, the less likely that the next generation is going to become addicted to nicotine. And why aren't we also dealing with alcohol and marijuana?
I would love to answer
yes,
that.
Amy,
We
I would love
are.
for you.
We are. I get asked this question. Of course we are. In fact, there's many members in this room who've been working on it for 12 years with me, from the schools to the police to community members, youth services, everywhere in between. Thing is, marijuana and alcohol are regulated differently. We are taking them one thing at a time, and this is the thing that we're working on right now. Now, one thing that you might be of interest is that the select board is looking to modernize their alcohol policies. That's another thing we're working on. We can walk and chew gum at the same time. Thrilled to do that. And so when I get asked that question, I get a little frustrated because of course we're working on those things. We're also working on prescription drug use. So happy to tell you that.
Thank you. And I couldn't agree more. Okay, we're almost done. So again, as Amy said, our vision is primary prevention. Our vision is the next generation of young people who think it's very strange to use nicotine, who don't see their friends, don't do it themselves, and don't see their friends doing it. And again, we've invited the Board of Health here tonight to listen, and they are really looking forward to your input because they are one of the possible paths for North Reading to adopt NFG, and promoting health and wellness and tobacco control programs fall under their purview. And as I had mentioned, town meeting is a less common scenario of how NFG goes forward, but also a possibility. So that's what we have basically. We'd like to thank you for coming. Please note that we have a couple of other upcoming sessions, and we'd like to take public input now. Any questions that you might have, any comments, any expertise that you might have, we welcome you to share that. When we had taken a list of people who would like to speak, and we'll go down that list, and then we'll open it up for anyone else who, after hearing the presentation, might have something to add. We ask you to please state your name, your town, or your expert affiliation, just so we can take some notes and have a record there. To please keep your comments brief. Amy is going to try to time about 2 minutes more or less, and she'll give you a little high sign if it's an issue, but there's not too many people here, so I don't think it's going to be a problem, and we'd like to hear that. So with that said, we please keep your comments respectful, and we'll listen, and if you have a question, we'll answer it. And we're just going to leave a little more information on the screen for you while we do that, right?
Yes.
There we go.
Unfortunately, Jen had to step out with her son has practice, but he wanted to speak, so I think she's going to speak on his behalf when she comes back. Ginny from Somerville.
Oh.
You can stay right there if you like.
All right. Either one. So, Ginny Chadwick, I am a resident of Somerville, Massachusetts, but I call Missouri home. I actually was a bill sponsor of one of the first Tobacco 21 policies, so helped communities across the country raise the sale age of tobacco products from 18 to 21. And I also co-authored a document called the Decriminalization of Tobacco Products. And so as we think about nicotine-free generation for communities in Massachusetts, and first of all, I have to say, how blessed Massachusetts is to have the power at the Board of Health level to make these innovative policies. And they really help to lead the nation in creating tobacco policies that can help future communities. So this is the starting ground for amazing tobacco control work. And I know, being in North Reading, you guys have voted on other tobacco control policies, right? Massachusetts led in local flavor policies, local tobacco 21 policies. So leading in nicotine-free generation is just the next step. I will say that as we think about this policy, sometimes I heard the word purchase or buy, and that's actually not what this policy does. It's not about restricting the buyer from doing something, and it's not about restricting the purchaser. What it is about restricting the sale. We restrict the sale age of which the person can be sold tobacco products, and that raises 1 year every year. And it's important to know that if somebody has the product, that's not illegal. So if we think even more about the personal freedoms, we're not preventing the person from using. We're not. but we know that we're preventing the retailer who's making a profit off of selling a deadly addictive substance from selling, and that sale age just gradually goes up. I thought the internet restrictions was an interesting conversation. Massachusetts is one of the states that has not restricted internet sales, although the PACT Act allows local jurisdictions to get information on internet sales, and I don't think it's preempted at a state level for locals to have an internet sales restriction. So as you talked, I was interested in hearing more about why you wouldn't add internet sales into that regulation. But you guys might have more of a knowledge of the local laws than I do, but you could get information through the PACT Act from the state on who was shipping into your local jurisdiction. So I would encourage you to consider PACT Act reporting, and because Massachusetts has failed to pass an online policy, I don't think it's prohibited for the local jurisdictions. And then, I thank you so much for letting us come and talk, and I look forward to hearing what others have to say.
Thank you very much. Calvin F. is a student.
Hello, my name is Calvin Fisher. I'm a student here in North Reading High School, and I'm in 12th grade. And I just wanted to give a little bit of a personal account of some of the instances of nicotine use that I've heard from my close relatives and even earliest friends. From a young age, in this wonderful school system, I made lots of very close friends who I still know to this day. And one that comes to mind, I met in first grade. We were like, bread and butter. We went together everywhere, made many very fond memories. And I just remember towards the end of middle school, our paths sort of diverging, each interested in our own subjects, our own areas, our own sports, our own commitments. And with time, we sort of communicated less and less, and when we did, it was less amicable. But even so, I still respected him, and I still cared about him. And a year ago, maybe even sooner than that, I recall calling him up and discussing life. And he told me a bunch of wild adventures that he had with substance use. And I have heard similar stories from cousins, people that I've known since I was 5, as young as I can remember that. And it really strikes me as a youth because it's people that I've grown up with, people that I've trusted, people that I care about who are doing this. And they're not even 18 yet. It's really concerning because if things like this don't get put in place, who's to say what the future will hold for people who will be my age in the coming years. I think the most important thing that I've heard from them, in telling me these stories, they haven't intended to promote the use of substances. If anything, they've told me not to. I think the biggest takeaway that my close friend and my cousin have told me is do not start nicotine. Because they've told me that my close friend who I met in elementary school, he told me that of all the substances that he used, nicotine was the hardest to quit, and that if anything were to come into my hands, that I should never start. And my cousin said the same thing as well. I really care about the future of this country and the future of this generation's health. And I feel like with policies like these, making it less and less probable that youth get their hands on nicotine products can definitely be beneficial for all and a lifesaver for many.
Thank you.
Thanks, Calvin.
Just wanted to say.
Yeah.
Did you sign in?
I have you on board. Thank you. Jen, I'm sorry we missed your son.
Oh, that's okay.
Do you have something you want to read on his behalf, or?
Yeah, no, I can do that. Can I?
Yeah,
I'll
that's
speak on both our behalves if that's okay. Sorry, basketball tryouts started right at 7:30 and I had
Sorry,
to.
yeah.
No problem. Sorry. Get my readers up here. Hi everyone, my name is Jen Leanders. I'm a member of the school committee, but I'm here tonight as a mom of 10 and 11-year-old boys. One of them was just here with me. So the NFG regulations apply to cigarettes, vapes, pouch tobacco products, everything like that. And as Amy and Marcy were saying, right now we have no idea what's next. I mean, who knew there was going to be toothpicks and highlighters and things like that? And the tobacco industry is an expert at marketing to kids. And as a parent, that's scary. Nearly 20% of high school seniors, as Amy was saying, report using nicotine products at a higher rate than the national average. Now, I'm on school committee and we sit here at this table and we get to hear so many good things that we are above the national average for, but this isn't one of them, and we need to work to decrease that. All 5th graders in North Reading get 2 sessions learning about the impact and the dangers of vape. We are really, really lucky to have Amy to be able to do that, because I can tell you that even at that young age of 5th grade, before they enter the middle school, it makes an impact. There were conversations at my home, there were conversations I heard amongst my son's friends, and it really comes down to a lot of my sons and his friends play sports, and what they were saying is, athletes aren't going to do this. Athletes don't vape, athletes don't use nicotine, we're not going to do it, we're not going to do anything that's going to impact our ability. So this could be just another tool, right? And on top of Amy's education and everything that the Substance Abuse Coalition does, one more tool. So more than 500,000 residents live in communities that have these regulations. Those 17 cities and towns, those kids now have an advantage over our kids. And I know we were saying, you can just go to the next city or town, go to Andover, go to wherever, but hopefully in time, that won't happen. Lots of public health measures start on the local level, and let's be at the forefront of this and not the back end. We don't want to be one of the last towns in the state doing this. Previously, I was the spokesperson for the Massachusetts Department of Public Health, and this is where public health measures start, on the local level. And this is exactly the type of thing that will have a huge impact in the future. NFG's goal is a generation of young people to never use nicotine products, and in just one generation, we've already accomplished so much. I'm sure we can all remember going to restaurants, the non-smoking section. Did that even make sense? You still smelled the smoke and came out smelling like smoke, and airplanes and things like that. And now, I can also remember riding without a seatbelt, going skiing and biking without a helmet, and not recycling. When we know better, we do better. So let's do better. Big tobacco is not going to stop moving forward, so this means we can't stop fighting back. We've talked about how young people are addicted from a young age, and many start before they're 18. Their bodies and brains are still developing. It changes the pathway of the brain, and it interferes with normal development. What NFG will do is make a positive change in our community and reduce the influence of the massive and powerful tobacco and vaping industries. So I'm asking the Board of Health, or if we have to go to town meeting, I'm asking to give my 10 and 11-year-old an opportunity to be part of that generation that doesn't use tobacco products. And now I was going to ask my 10-year-old to say a couple words. And I just want to be clear, I asked him to sit down, I told him about this, I asked him to write in his own words, I told him what I thought were the pros and what the cons were too, about, there are different retailers in town, and we are a frequent visitor of Christopher's and 7-Eleven, and we love all the retailers in town. So I told him the whole story and I asked him to sit down and write his words. So obviously more impactful coming from him, but this is what he wrote. Hi, my name is Finn Leanders. I'm 10 years old and a 4th grader at the batch. My parents have been telling me my whole life how bad cigarettes and vaping are. I don't ever want to try them, and I hope my friends don't either. I play lots of sports like hockey, baseball, football, lacrosse, and I'm going to basketball tryouts right now. I don't want anything to hurt my lungs that could impact all the running that I do. Also, I love the convenience stores in town. I will continue to go them and will buy even more candy, Gatorade, and worms for fishing. I hope all my friends will join me in not trying any tobacco products. Because I do think it's important to hear from the people that this is actually going to affect. So, thank you.
Thank you. I didn't catch your name, so I know you wanted to speak. I'm Elizabeth Ayer. Hi, Elizabeth.
Hi, my name is Elizabeth, and I'm a 10th grader at this school. I'm here to talk about smoking and vaping. I personally have never done either of these things, and I don't ever plan to. None of my friends do either, although I have seen and heard about many other people doing it. Even though smoking and vaping is legal, I know that they are unhealthy and they can form really bad habits that can be damaging long term. Both my parents work for the FDA, and they often talk about how dangerous vaping is for many reasons, but especially due to the risk of overdosing and how much it can impact the brains of young people like me, whose brains are still developing. And everybody knows the dangers associated with smoking cigarettes. Even though I've never participated in either smoking or vaping, many of my relatives have, and many of them have died from it. My great-grandmother died of lung cancer and emphysema. My great-grandfather died from throat cancer. My grandfather died from a bad heart after decades of smoking. And my uncle had open heart surgery in his late 40s due to this kind of unhealthy behavior. In the end, I know it's legal, but kids shouldn't be smoking or vaping before the age of 22 because it's just so damaging, and it can waste so much potential in people. Thank you for your time.
Jen Ford.
Hi, everyone. My name is Jen Ford. I live at 15 Maple Road here in North Reading. I wear many, many hats in this community, but I'm wearing my parent hat tonight and my grandparent hat. I'm a lifelong resident, so I've been here a long time. Not to sound negative, but there was a time that North Reading was known from the outside communities to come for youth to buy alcohol. This was many, many years ago. And fortunately, that has changed. And fortunately, we've shifted from being kind of the go-to place to being pioneers and leaders in so many ways. And as a parent, I really hope we'll continue to do that. You know, I have an aunt and an uncle who were both very heavy smokers, and despite having emergency quadruple bypass and emphysema and COPD and literally gasping for air, they could not stop smoking. And to see that firsthand and to know that we could prevent our next generations from having to experience that, to me it's a no-brainer, and shame on us if we don't make it happen. So thank you everyone for being here, and thank you for your time.
Maureen Busby.
Oh, good. Yeah, there are some people behind me. Maureen Busby, I live in Melrose. I am the Regional Tobacco Prevention Program Coordinator for 7 communities. And 6 of those 7 communities became the first boards of health in the entire world to adopt NFG. And they did it after careful consideration, as you folks are doing, and getting data. My boss, the health director, is an epidemiologist. He's interested in data, looked at that data and said, we're doing great things. We've been a leader. Massachusetts is a leader, but our kids are still vaping. They're still using nicotine products. What else can we do? So we looked at the Brookline model, and we actually changed the name from tobacco to nicotine because there were more nicotine delivery products that were non-tobacco than tobacco. And you saw some of them tonight. And I want to mention, in addition to the ones that you saw tonight, I recently attended a national tobacco conference in Chicago and learned from a researcher there that the latest products that we haven't seen yet in our local stores are kind of like your smartwatch. They're gathering data all the time. So if you get one of these newer vapes, they're going to track how much you vape, when you vape, how often you puff in between, how much time in between. New vapes, you can dial up the nicotine level. They're pretty high now, much higher than a cigarette, but you can dial it up. There are some that you can dial the flavor up, get more intense flavor. That's what the industry is doing. I think Amy mentioned that the industry is literally looking for their next product right now. The data that they're collecting on these vapes is being sent back to the manufacturers so they can do more to find out what our habits are. Think of what's being collected on us now in the cars we drive, wherever. So it's really important for us as local public health people to do everything that we can to put a spoke in the wheel of the tobacco industry. They have the money, we don't. They make billions of dollars in profits every year. They spend millions just in Massachusetts on marketing. We can't do that, but as the school committee member, sorry for the name, mentioned, we have the power of promoting local health in our community, and then that leads the way for the rest of the state. We did it with pharmacy ban, we did it with the flavor ban, we did it with raising the age from 18 to 21. We did it with smoke-free workplace law. That started in one community, moved to other communities until there was critical mass, and then we were able to pass a statewide law for all of those policies. And that's what we hope for this. Because yes, somebody could go to the next community. We don't want them to do that. We want to end this nicotine addiction and all the health issues it causes, the financial burden that it is for the people who use nicotine products and who are affected health-wise financially. But also there's a career issue for our young people. There are many careers that young people can't get into these days if they use nicotine products. can't join the local firefighters or, go to the police academy. Many youth do not know that, and actually many parents don't know that. But as we learn this, we can do things on the local level, leading to state policy, and then hopefully even to federal policy. And in fact, when I was at this national conference with people from every state and territory, every workshop that I went to, they always mentioned Massachusetts and California, because we are the leaders. We want to continue to be the leaders. A bill has been filed in the State House, both in the State Senate and by Rep. Patola from Brookline. And we need to get critical mass. So it's important for this community to join the other communities that have done that. One, because as Amy mentioned, Stoneham has done it, Wakefield has done it, Reading has done it. We don't want those kids coming here to North Reading to buy their products. And also we need that critical mass so that then the state legislators realize that there is support for this on the statewide level, and for them to vote to have this be statewide law. Thank you.
Peter Majane.
That's a hard act to follow, but Maureen, thank you very much. You're a critical part of what we're trying to do here in North Reading. I don't reside in North Reading, I live in Woburn, but I've been here for 28 years working for a local bank and been used services for over 10 years now. Amy recruited me actually, thank you very much, and been chair of the committee. So there's 11 people on the committee, and 9 of them reside in North Reading, and they are very much adamant about this program, its success, and are doing everything they can at their local levels to speak to their neighbors and their cohorts to try to push this through, and maybe the Board of Health or town meeting can move it forward. So thank you very much.
Rita Mullen. Okay.
I exercise for today. It's Rita Mullen, I'm on Recreation Community Impact Team Organization, and I was one of the original members of the Youth Service Committee. And it was important at the time the way it started. There were a couple of times in North Reading, families in North Reading. One at one point had lost their daughter to a terrible car accident before other children in North Reading died. And it was around the time that drinking was involved, etc. And it was around the time that every other year we lost 3 other kids from North Reading, 2 other kids to car accidents. It was a terrible time. So one of the members of the first committee started the youth services and a group to say, what can you do to get a new service director? At that time, of course, not going to have a recreation director, this or that, and time was of the, essence that money that we didn't have time to do anything. So 12 families in town put money together and paid for the first youth service director we had in town. And they said to the select people to talk, and Marcy was there and all that during that time. But they said, we'll put in enough money for 2 years, $5,000 apiece, and we'll get this done. So we started the youth services. We've had some great directors, Amy being one of them, Jen Ford being one of them. Marcy has been a backing of this since she was a selectman and member in town. So I am ecstatic that this committee has grown and grown and grown. And if you think of it, the 2 directors that were regular kids that we hired when they were younger, what they are today, 12 years later, is going into this great group. The same thing that Jen has come back. And they look at it that I know that you're going to be a group like this, someday they just pointed to you and remember it. And I started in recreation years ago, and I had the coaches that thought drinking was okay at the fields, parents that went to the baseball games, and you had the parents that said, okay. As a kid, I was popular, but I was always still the one who was the Debbie Downer, didn't drink, didn't do this, and had to be the person who drove people home because they were too drunk, and they smoked all the time. And the only one in my family was 6 that came down with cancer 3 times. And the funny part is, I think when I sit here and I think of these different things, that I was my father's favorite. I was a little tomboy in school, so I always sat behind him in the car. And in those days, they always smoked the cigarettes that had no filters. I sat behind it. and the smoke always came in your face, and sometimes a little, cigarette burns. Now, I'm not blaming my dad, but he died at 66, and I had cancer 3 times. And my older brother that smoked all the time, and he said out of 6 kids, he was second in family, he died of, the tobacco. So I do believe in this. I believe more in these kids that have joined the group and brought it to this point. I'm ecstatic that when I say that I'm popular, people have a wise guy, but I didn't do the drinking, I didn't do the smoking, and they would tease me, even the mothers, to say, oh, that's right, you're the good one, you don't do anything. You never laugh like that, because those kids smoked and drank. And as I get older, I realized it was kind of cool to be that person. It was okay, I was good in my own skin and it was good to talk. The courage that you kids have shown, and that's Marcy when you were a select person, Amy, that you thought that you didn't give it in a town like this, you can after a while, like the TA, like this person, like that person, and if they don't, back it, you say, other people might back down and say, I'll do the best I can. You fought and fought and fought for things, just like Jen did. Both of you maybe in different ways, but you still kept fighting, and I have to give Patrick Daly a lot of credit that when you kids started talking about nicotine and different things, you weren't afraid to have the school come in. Patrick wasn't afraid to tell you it's all right to come to the school and talk about this. I think it's time that I have to be courageous also. And he did. It was a great partnership. So I guess I'd say in the room, I think we're all, we're talking to the right audience. We want to see it stop. But when I remember the 50 years of being on recreation, the different cycles of coaches that have come through, and I say this to every member of the school committee, I say this to every member of the selectmen, be courageous. It's like you say something, see something, don't be afraid to say anything. I love it. I want to adopt it. But I want this committee, this town, to be courageous and not be afraid, not keep going after the selectmen, the finance, the Board of Health, because I've heard from even some of the people on 3 of the committees and more. Who are you guys that be telling us what to do and I have to go to another school and my kids can't go here? I believe in our rights. You're not Big Brother, whatever. And I said, no, you're right. We're not Big Brother. But you know what? We're not going to back down to the friends vials and people that are pushing us back. So I applaud everything you kids have done. Patrick, thank you for coming forward. Catherine, too, hopefully you're a new person on the Board of Selectmen. Maybe there are some people that can actually talk out loud about this. And every one of us gets 4 more people, get our kids to understand this. And I am proud of my kids that they don't smoke cigarettes. They don't smoke other products now. So I thank you all for what you've done. And there's one more thing in the beginning when you started about the seniors and doing things for the seniors. I think there should be a DFG, a dessert-free generation. Hopefully we'll start that
Crazy.
after this. Thank you
One
for all
thing.
that.
Thank you, Rita. Sir, do you want to speak? Sorry.
I'm from out of town, so I think you have a lot of great speakers from the town. I would rather wait until we've had all the other speakers in a long time.
We did. I'm the last one.
All right.
So please feel free.
I tend to be a little bit softer spoken. Is it okay?
Absolutely. Come on around.
So my name's Anthony Ishak. I live in the town of Brookline, and I was one of the co-petitioners for the first town to pass this, and the first municipality in the world to pass it. During the day, I'm a pharmacist at a local hospital system. I work in primary care. I'm just going to take maybe 30 seconds to tell you a little bit about the background for why we did this in Brookline. But I also want to cheat. Can you pull up your FAQ slide?
We're getting there. That one?
Yeah, that one. That's perfect.
Okay.
Because this basically summarizes a lot of the arguments that came out against it and some of the reasons why we did this. So the reason we did it in Brookline was, if you remember, prior to the pandemic, there was the whole vaping epidemic, right? It was on the front of the Washington Post, New York Times. And we passed a flavored ban at that time, and the state followed 6 months later or so, a year. And I remember specifically meeting with the law group from Northeastern who spoke for Brookline and took up the case and won 9-0 in front of the state judicial court. And in meeting with Mark and his group, there was 4 of us in the room. Kate Silva, who's a co-petitioner, she's a BU law professor. She's not here today. I suspect she will speak on this. I remember asking Mark, okay, what is it that we can do, because they just keep coming out year or decade after decade with new ways, and we can't constantly think about what they're doing in the lab. And this is why we came up with Nicotine-Free Generation, because of the points that have been summarized, which is this gets ahead of it. This just says, forget it, the game's over, you guys are cashing out, right? Like whatever ideas you're coming up with at that time, I thought it was gonna be nicotine patches. I did not think, I thought it was going to be like nicotine addictive patches, not the prescriptive kind that help people stop. I did not anticipate things like toothpicks and highlighters and things like that. So I think that's where this is important. There's a couple of ideas that I had asked about. I would encourage you not to think about the internet right now for a couple of different reasons. There's a state bill. 2, it is incredibly hard for a municipality to sit there and try and figure everything out with internet sales, because we know Amazon has thousands of retailers. Youth are getting this locally. They're getting it from their peers or places locally. The internet is not the bang for the buck right now. It's this. The reason I bring up this slide, cross-border, we know that doesn't exist. We know when you pass this in a town, when Needham did the first in the state, or one of the first in the state passage of increasing the age to 21, they did a study that was published in medical peer-reviewed journals that actually showed their youth rate went down, even though the places around it stayed the same or went up. In other words, it worked. People did not go over. What's called cross-border leakage is just a fairy tale that is spoken to you by tobacco and lobbying groups. We know this works because there's another example, and that's with like sweets. Places that put on taxes for sweets see people buy less sweets. The money stays in town, does not go to nearby towns. So this idea of cross-border leakage doesn't tend to happen as much. Cigarette use is down. We know this is another speaking point. There are tobacco industry groups that have actually funded nonprofit.org websites that make it look like they're speaking out against tobacco in order to get people on board to move them towards things like vaping and towards nicotine pouches. We know that right now about 1 in 4 nicotine pouch users are underage already. We know that people who vape, they show lower college cognitive scores compared to people who don't. And that's relatively quickly. In the last 5-10 years, we've seen vaping, and we know this. So it's a classic nicotine speaking point to say, wait, this is going to be safer, this is going to be better. What they're waiting on is for people to get addicted, and then for us to react to it. So I would really encourage you to think about this, doing it locally. It makes a big impact locally. I can tell you for retailers in Brookline, we're nearing 5 years, it will be 5 years in January. We've had 2 give up permits saying that it wasn't worth the money. One was Stop and Shop, which everyone knows. The other one was a local retailer. When they were asked why they gave it up, they said it just wasn't worth it. The $200, $300 for the permit was not worth the money that they could get from this. So they gave it up. No retailer has shut down because of this. And we're 5 years down the road. So you imagine it's so incremental that it just takes time. And then the last point is, in this state, especially with everything that's happening right now with the discussion at the national level of healthcare, every household pays $1,200 from their taxes towards our state health. State health right now is one of the biggest things in our budget. So it makes a big difference for us as individuals, like $1,200 going back to our roads and our schools and our law enforcement makes a big difference.
Thank you, Anthony.
I do have 4 testimonials that students asked me to read on their behalf, so I wanted to do that tonight. I have Kaylee G. is in grade 10. Nicotine is something that so many people struggle to give up. Many people start young and others wait till it's legal. Either way, the effects are the same. Every person who smokes any form of nicotine feels the effect of the poison that are cigarettes, vapes, etc., which is why I think that we should prevent people from smoking for as long as possible. James C. is also a 10th grader. I support this because not only have I been online since I was 3 and have seen the negative effects of nicotine on the body, but my mother has been smoking since I was born, and I am constantly worrying that nicotine will take her from me when I need her the most. Nicotine scares the hell out of me. God wouldn't want me smoking or dealing with nicotine either. James is also a student athlete. A freshman who wished to remain anonymous. Being a high schooler, I have seen several cases of people abusing nicotine and other substances, both within my social circle and otherwise. Initially, I was introduced to vaping and its effects at a presentation in 5th grade, but I first saw one in person at a sleepover 2 years later. Soon, I tried it out of curiosity and developed the perspective that it was absolutely fascinating. I figured I wouldn't keep it as a habit, but continue to use it when I was with those friends. Shortly after, I had a falling out with this group, and I haven't touched a product with that intent since. Though I am still aware of the individuals around me who use nicotine and how many of them have expanded their horizons to other substances such as cannabis. I'd also like to remain anonymous. I'd like to mention that much of the reason I've stopped vaping, besides the end of that friendship, was because nicotine addiction is present in my family. I think that Nicotine-Free Generation is a great idea and a large step closer to a healthier youth in North Reading. I am hopeful for the future of the town. And the last one I wanted to read was from an 8th grader, Nora. I'm a student at North Reading Middle School. I think this is a good idea and law to pass to stop addiction. So I wanted to read those voices of the students who couldn't be here, didn't want to read out loud. Is there anybody else who wishes to provide any information?
I think you get one thing, nobody does. It's okay.
Anybody else? Go ahead, Rita.
Paid political announcement is possibly for the next round of budgets in North Reading. There is a possibility the service director is being interviewing now to replace somebody, but they did mention at the select meeting the other night that they just showed different positions that may be cut eventually because of money. And that is one of the things that I have said before to the selectmen and finance, but I think sometimes it has to be drilled into them. Again, when they look at this room and what youth service has done and how Laura and you and Jen have built this whole group, that I said to them, I've had a fire at my house and I had firemen come and save everybody in the house, wonderful. And we don't have a lot of fires in North Reading, but I say that for the firemen and the policemen, we know is extremely important. For the school and the teachers, we know is extremely important. But when you look at also your service director that is with the kids, that usually are the ones that kind of go down and out and they can get to them, trust me, they talk about smoking, they talk about these things to the kids. And they save as many lives as the police and the firemen do in that time. And I've had two 28-year-olds that can remember everything that the kids that they looked up to, the role models of the people that they had and talked to them in school when they were in the 3rd, 4th, 5th grade that came into it. And the new service directors, we had the DARE program and different things along those lines. But it means a lot, and again, that's one of the ones I'm asking when we get up in town meeting, be courageous to say, yeah, your service is important, it's police, fire, teachers, because I believe they are. Just my point of view, thank you.
Rachel.
I'm Rachel Fisher. I'm here as a parent. My son, another one of my sons, this is one of them, sent in a statement last night, kind of late by the deadline because he's a college student. And
He's on my list for next reading.
Oh, okay. Well, I just wanted to highlight something because you mentioned about social, being acceptable socially and how smoking isn't acceptable socially anymore. One of the things that struck me out of his statement, because I asked him to send it to me first too, is he said in any social situation there's nicotine. I mean, anyone. It's not, he said some people even smoke cigarettes, that was sort of the weird one, but otherwise it's so common. He's at RA for the 3rd year, he talks about the Zyn packs that are stuck to the shower walls in the dorms and spat out in the drinking fountains and stuff in the dorms, it's ubiquitous. And he's in a freshman dorm, so these people are all under 21. So sorry to steal your thunder, but those were 2 things that really stood out to me as, hearing about how really, really common. And just by the way, because I tried to help with the vote a little bit on this and bring out some people who would speak on behalf of it. And I talked to some parents who were like, what are you talking about? My kid doesn't use nicotine. And I'm like, no, I'm not saying, that's not what I'm saying. I'm saying they've seen it. Would they make an impact statement? No, none of my kids do that. What are you talking about? And I was just like, oh, just keep on dreaming. Like, we talk about it in our family, and that's why kids are like to make statements. But like, there's certainly plenty of parents who would like to turn a blind eye and be like, never my child, right? That's what my parents thought too.
Thank you. Anybody else? Well, just for the good of the group, we do have the 2 other sessions coming up, and I do have several other statements from graduates. So Wes is in that pile, and some other adults. I always say at the end of all of our presentations, if you forget my name, I have no problem with that, but please don't forget Laura Miranda. She's in the back there, if you don't mind waving, Laura. Laura is the town's mental health substance abuse clinician. If you or anybody you know, and statistically we all know somebody who could use a little help. That is Laura's contact information. She works out of the police department, but all information is kept confidential. And she is happy to make any referrals for any substances needed. So please consider taking a photo of that so that you have her number and information. If you know of anybody who would like to submit testimony that will be passed on to the Board of Health, that is the QR code to fill out the form, and we will provide that to the Board of Health at the end of all the sessions. Thank you for your time. We're pretty on time.
Yes.
Pretty on time. Thank you so much for your time. I appreciate it. I'm going to stick around if anybody has any questions after, but have a great night. Go Red Sox.
Thank you, everyone.